to Sci-Fi Health News. Today's episode will be highlighting the exemplary work of women who changed the world with their achievements. India was facing heat for its low testing rate. A new development could have helped scale up the country's testing capacity for the novel coronavirus. The World Health Organization emphasized on the importance of increasing testing to contain the spread of novel coronavirus. Women who raced against the time to develop India's first homegrown COVID-19 testing kit. Meenal Thakave Bhosle, a virologist who led the team, raced against time to create the patho-detecting testing kit for coronavirus. The kit, which would have taken 3 to 4 months for the completion, was developed in 6 weeks. Besides managing to beat the clock, Bhosle also powered through a personal battle. She had only started working on the creation of the kit in February, and at that time when complications relating to her pregnancy had just surfaced. Despite these obstacles, she soldiered on and believed that it is her work and she wanted to serve the nation. She successfully presented the kit for evaluation by the National Institute of Virology on 18th March and submitted the proposal to the Indian FDA and Drug Control Authority seeking commercial approval. This was Meenal's story. There are many discoveries that made the COVID-19 vaccine possible, and one of the most essential researches was that of Kathleen Carrico, which focused on the therapeutic possibilities of mRNA. Yet her idea that mRNA could be used to fight disease was deemed too radical, too financially risky to fund at the time. She applied for grant after grant but kept getting rejections. Eventually, Carrico and her former colleague Drew developed a method of utilizing synthetic mRNA to fight disease. That discovery is now the basis of COVID-19 vaccine. While COVID-19 containment measures led to long periods of isolation and stay-at-home orders, many found themselves trapped in unsafe relationship or violent environment. Megs Shah and Feroz Ahmed recognized the need for new technology to the best reach those in need and to enable the service provider organization to actually connect with domestic violence survivor and manage case virtually. The Parasol Cooperative founded by Shah and Feroz is working to educate and connect survivors and those in need and in the service provisions. A quote by Albert Einstein: "The woman who follows the crowd will usually go no further than the crowd. The woman who walks alone is likely to find her place no one has ever been before." Years after years, confident, courageous, intelligent, and determined women from all over the country make it a big and a rare success in various fields. Even though there are numerous women deserving of honor in their field of excellence, I would name few famous Indian women here who have made a lasting impression on the world. Geeta Gopinath. She is a Harvard economist who became the India's first woman to assume the position of chief economist at International Monetary Fund. She is originally from Kerala and is a daughter of a farmer entrepreneur. She is presently the professor of international studies and economics at Harvard University and also the co-director of the International Finance and Macroeconomics program at the National Bureau of Economic Research. Her exceptional skills and vast experience make her an excellent fit for the IMF. Kiran Mazumdar Shah. She started her own venture Biocon in 1978. Today, she is ranked 60th on the Forbes list of most powerful women in the world and is the richest self-made woman billionaire of India. She is currently the chairperson and managing director of Biocon Limited, one of the largest biotechnology and biopharmaceutical companies in India, and the chairperson of Indian Institute of Management, Bangalore. Along with this, she is also a member of Board of Governors in the Indian Institute of Technology, Hyderabad, and has been given due recognition for her achievements from the Government of India, who conferred her with the Padma Shri and Padma Bhushan. We honor all these women for their achievements. Thank you.
Dr. Rakesh Gupta and Professor Dr. Sonu Goel, the anchors of the show. We welcome you all for the special edition of Cypher Health News Channel on the occasion of International Women's Day, March 8th. International Women's Day 2021 campaign theme this year is Choose to Challenge. We congratulate you all on this International Women's Day and thanks for watching Cypher Health News Channel. And today we have with us Dr. Mira B. Aghi. She is a PhD behavioral scientist and expert of international repute, a freelance expert since 1992, and specialization in education material production 1972, and from Loyola University, Chicago. She did PhD in psychology in 1969, and from the same university, she had MA psychology in 64. Her area of expertise is behavioral science approach to health and development and the framework convention on tobacco control. She was asked to write a position paper on women, children, and tobacco. The paper also exposed the BD mafia, whose middlemen they exploited women and girls in the most inexcusable manner, which needs urgent attention.
So, Miraji has several awards to her credit. The primemost award, which is the Nobel Prize, which we can say in tobacco control, that is Luther Terry Award in Community Service in Tobacco Control, she got way back in 2012. And she also is the one of the 20 women achievers in healthcare by Modern Medical Magazine in 2009. She achieved this WHO community certificate and a gold medal for continued commitment in the field of health to the cause of tobacco-free society. And she was the first person in the Asia to get this medal. And she was instrumental in development of innovative TV program material in support of satellite international television experiment by Dr. Dhawan in 1976. She has been a visiting scientist from 2010 to 18 in Harvard School of Public Health, a visiting scientist in Department of Society, Health Development and Human Development and Health. And she has been an advisor and consultant to South Asia Health, Immigrant Health and Cancer Disparity Service, Memorial Sloan Kettering Cancer Center. So she has many awards to her credit, besides being a board member for Society of Research on Nicotine and Tobacco, SRNT commonly called as. She has been there for last 8 years. She has been a board member of International Union Against TB and Lung Diseases, chair of Tobacco Control Section from 2017 to 2019, and a board member of INWAT, that is International Network of Women Against Tobacco Representative, South Asia.
So her current and past positions, may I continue, as she is a board member or founding member. She's a founding member, actually, the advisory committee member, Advocacy Forum for Tobacco Control, AFTC. She is board member of Free Tobacco. She's board member of Human Rights Tobacco Control Network, board member of HRTCN, and the Global Youth Tobacco Survey. So she was coordinator for New Delhi. So in Ministry of Health Family Welfare, she has designed a manual known as a Healthcare Workers Guide to be used by by anyone who is working with people to educate them in the health, social, and economic consequences of using tobacco products. IDRC South Asia and Southeast Asia Regional Office, New Delhi and Singapore. She was the Senior Program Officer Communications for 3 years, and she has also worked in Tata Institute of Fundamental Research, Bombay. And she actually single-handedly destroyed the efforts of tobacco company to market a ladies' cigarette called MS cigarette in India.
She has worked as a consultant in UNESCO Paris. She had worked in UNICEF for many years, UNICEF Afghanistan, UNICEF Myanmar, and UNICEF Southeast Asia Regional Office, Nepal, for women and child health issues. And many other areas. She has worked in Danish AIDS Agency and the Care India. And she has many credits, and she was the vice president of research, early childhood component of education technology, demonstration of Rocky Mountain experiment in USA in 1972-73, and she has worked in many universities, including Loyola University, Chicago, and Education Commission of State, Denver, and she also worked as a research scientist in satellite instructional television experiment way back in 1975.
So other work experience, she is a consultant, South Asia Coordinating Group on Action Against Violence in Women and Children, with the membership from ECPAT, Plan International Save the Children, Sweden, UNFPA. She's member WHO panel on smoking and health. She's member steering committee for International Children's Center Paris 1973. She has attended many conferences and presented many papers, and uh, she has authored actually hundreds of conference papers and formal publications. And the recent ones are factors associated with the successful tobacco use cessation among the teachers in Bihar state, India 2020. Yes, it is the perfect time to quit, fueling tobacco cessation in India during COVID-19 pandemic, and counter powered by the Voices That Matter. That was in December 2020. So Miraji, so we'd like to know about your early childhood and about your family.
Well, I was born in Jalalabad. Our family is known by Jalalabadi. It's more than my surname and all that, because my brother was in the movie industry, very famous movie writer, Kamar Jalalabadi, way back. So I was born in Jalalabad, but stayed only for a couple of years. All that I remembered from that is that my father, he worked for the British, and he worked in the village, and the Britishers used to come to our home. So we had a very nice living room, which he had constructed. So it was the memories of that time are very few and far. But then I remember, coming to Bombay from Lahore, where we had gone after Jalalabad, and then since then I grew up in Bombay till I came to United States. Well, I think that one of the questions probably you have in mind is that what made me go to Loyola or to do my PhD in psychology. My father was very much interested that I should go to England and study, because that's where he studied. But when it came to the time for me to go to college, he found out that psychology was much better in the United States than in UK. So he sent me. He had some friends in Chicago. He worked with them, and so I came to Loyola, and I did my PhD in 1969 in psychology. But then I think that what was very, very significant was that my minor in psychology was in early childhood development. So I was doing a lot of research during my courses, and it happened that one of my professors who was consulting at CTW, Children's Television Workshop, he got me apprenticeship with them, and so I did research for the children's television program Sesame Street.
Okay.
Which is a very, very famous, well-known children's program. And so that's where I learned early childhood development and early childhood programs. And the theory, of course, I studied at Loyola on early childhood development. I think this came very handy because when we moved from Chicago to Denver, I was not even looking for a job, but I got a job at the Education Commission of the states. And lo and behold, they appointed me as the Vice President of Research for Early Childhood Programs. Rocky Mountain region is a very rugged region. So the communication is very, very difficult. There was no television at that time, no radio. It was very, very difficult. So they requested NASA to come up with a geosynchronous satellite so that which they can use in the Rocky Mountain region and have television programs which they can broadcast and maybe achieve their objectives of development. And one of the area was the early childhood. So I was appointed as the vice president of research for that particular area. But the interesting part was that while I was doing that, NASA would come to Denver almost every month and ask me how I was doing. And they were gauging my interest if I would go to India, because what had happened was that Sarabhai had requested NASA to lend the ACF satellite to India for 1 year so that they can also experiment with the television in the rural areas. Because Dr. Sarabhai was very concerned that the population in India is increasing, but there are no schools proportionate to that, to the changing population. So he was very much interested. He thought maybe we can, by means of television, we can educate our children and also adults. So he was very much interested in that, and so NASA was coming to Denver to check out if I would be interested in going to India after finishing up the experiment in the Rocky Mountain. So they offered me a mission to India, which was very, very prestigious, because you usually don't come to your own country on a mission. But this was a mission that they were bringing me to India, and they were bringing me to Pune, where the Film Institute was, so that I can set up a prototype research and production unit there and train producers for the programming for the ISRO experiment. And I did that. I trained about 9 producers, and they were all doing science education program for children. And these were very, very interesting programs because I was trained in producing programs educational for children, but at the same time they have to be very entertaining, because the children would not pay attention to the television, what is happening on television, if it was not interesting for them. And one of the producer was noticed very widely, and so he was approached by Tata Institute of Fundamental Research, where our star Dr. Prakash Gupta was a scientist, and they asked this producer to make a film on tobacco habits and oral cancer, because Dr. Gupta's group has been doing research for the last 10 years to find out where in the mouth cancerous lesion will come up. If a person was smoking bidi, where would it come? If a person was chewing tobacco, where would be the lesion and where would the cancer would occur? So they asked the producer to make a film, and the producer said that he cannot make it by himself. I have to work with him, because that's what I was doing with the producers. I was helping them to decide where to start the film, where to end the film, and everything. And so they, Dr. Gupta's boss, Dr. Mehta, agreed. And so, I was taken up, and but I didn't know anything about tobacco at that time. And the interesting part was that Dr. Mehta asked me if I would help them to use this film to make the rural population give up tobacco habits. And I said, how can I do that? I know nothing about tobacco. So he said, I will give you time to learn what is tobacco and why do people use tobacco. So they took me up as a on job, and so I worked with Dr. Gupta's team, where Dr. Gupta really taught me what tobacco was, what is addiction, how people take up tobacco, and why do they take up tobacco. And I studied all that, and I designed an intervention, and that intervention was the most successful intervention, where there were regression of spontaneous regression of cancerous lesions at the end of the experiment. So it was very,
Right.
very nice.
Right.
And then the end of my mission was coming in India. So I asked UNESCO if I can stay back and not go back to US.
Yeah.
They were
Yeah, that is great.
surprised, but they agreed. So I stayed back, and here I am
Yeah.
working with you people
But it
on
is
tobacco
really
control.
very interesting that in 1960s, when not many women, they were even graduates, and you did your doctorate. It's really very encouraging for women, and it's very interesting as well.
Yeah, it's
Well,
also interesting, ma'am, that it's
uh,
also interesting that besides doing PhDs way back in 1970s, you have chosen a very unique subject and a unique area, that is development of innovative TV programs, when many girls have not thought about doing venturing into such type of areas. So that was really commendable.
I think it is the opportunities that I got because of the satellite experiment. The UNESCO took me to International Children's Center, took me to Germany at pre-Jeunesse for family television programs. So I think it was the exposition of all these things with the background from children's television workshop which equipped me to do communication, and communication along with psychology just equipped me to be a behavioral scientist. So that is how how I was able to work in tobacco, because in tobacco, tobacco is a behavioral problem, and only a behavioral scientist can solve such a problem.
Yeah. Great, ma'am. So I think another thing which viewer would like to know, besides your unique experience which you have shared about how you entered into this new arena of TV program, innovative TV program, and you told about Sarabhai. I think he was, I think, a great illuminary, and then how that journey led to Dr. Prakash Gupta, who is another illuminary in tobacco control. So just wanted to know, ma'am, like your special passion now for last couple of decades has been in tobacco control
Well,
and women oriented issues.
I,
So
I,
this
I,
is this is
the
this is well known by the world. So how did you develop that?
well, you know that it was actually a children's television workshop. These programs were for the disadvantaged children to begin with. Of course, they became famous for everybody. Everybody started watching them. But
Hmm.
it was a head start for these children, for the for the Chicano children and for the black children, the minority children. And so it was an illumination for me that children and the disadvantaged people don't camouflage you. When you ask them a question, they give you the straight answer. So even in my acceptance speech of Luther Terry Award, I said that I learned the most from the disadvantaged class, which were educationally disadvantaged and economically disadvantaged, and women mostly, because they are not really very schemy, that they will camouflage, they will give you the right
Hmm.
answer.
Yeah.
Learned from the disadvantaged class, and I applied it for everyone. And the and the women more so, because I think that women, unless you ask them, you would never know what the reason for their particular behavior is.
Right.
You cannot find out why a woman does a particular thing unless you ask her. In the case of men, perhaps you can tell, and also because it's a dominant society, women, men dominant society, and they talk a lot. But women, if you do not ask them, they just keep quiet and do themselves.
Yeah.
And it is so, this has been in my heart for a very, very long time, since a very, very long time. And I started working with women. It's more rewarding for me to work with women because I understand them much better. You know.
Yeah, so wonderful, ma'am. Amazing. I think that's a very inspiring story about how you were involved with tobacco control. That's another issue which is very touchy, and especially in tobacco control, you touched women and children, and why you have touched, I think, and touching the disadvantaged group and using those disadvantaged group to their benefit. I think that's really amazing. So another thing which, ma'am, I want to know that
sorry, excuse me, not only to their benefit, but they help me to understand all women.
Right.
So, I applied that even for the higher class women and for the middle class women.
Right.
I applied that,
Right.
And,
so,
and the dictum is that you have to involve them. And you have to involve them right from the beginning. You cannot say that, I am making this policy for you and you do what I tell you.
Right.
Because
right.
I found out that the reason why women take up tobacco is very different than why men take up tobacco. It's very different. They do it for different reasons. They do it for assault, personal assault. If you shout at them, they don't know what to do, and perhaps they would start chewing tobacco. So I think that it is a very different story in the case of women. I think Rakesh Gupta from Rajasthan will tell you, who has worked with all kinds of population, that working with women in cessation is very different, because women take up tobacco for different reasons than men. So that is why if you apply the same way of using cessation with them, it doesn't work. It doesn't work.
Right.
It has to be based on their experience. It has to be based by how they got elected. What would make them give it up?
Yes. So I think amazing, ma'am. I think amazing thoughts. So besides doing a wonderful thing in implementation, you had written hundreds of papers and the formal publications, as well as you were reviewer of many scientific journals. So how could you do that despite so many commitments? The youngsters pursuing public health would like to know about this academic rigor, how that academic rigor is there.
Well, I think you will, I will here, I sort of disagree with you. I'm not a great writer or of papers, publication and stuff like that. Conference papers, yes, I've done a lot, but I think that the academic publications, it's not in my area so much. But anyway, I have done it. It's not that I've not done it. I think that way back, and I have been stressing this even to our people who are working in tobacco control. Like I keep on telling Deepak Mishra all the time, that have people document. This is what I learned very early on, that you should document whatever you do. And if you document, then it's very easy to write paper. If you have documented everything, it's very easy to go back and to write papers. So I think that all young people, when they are doing any work, I think they should really document. Day in and day out, I see them that they go to these people and and find out whether they are selling illegal stuff or not. I think it is good if they also write it down, what they saw, and also I think it's very, very important for them to speak to these people and see why they are doing that. It's very important to find out why they are doing that, not just find out that what they are doing, but why they are doing that. And unless you find out why they are doing that, you cannot help them to stop doing that.
Right.
This is my philosophy. I don't know. This is my philosophy, that unless you really find out why they are doing that, you cannot stop them.
So in scientific science, we called this why as qualitative research. So I think in this qualitative research, I have read some of your readings, that you have done some qualitative research on women, and some of the things which you have presented, although not academic, as you have rightly said, that not many academic publications, but yes, scientific publications in terms of some position papers and in terms of the conference papers, you have really done well. Yeah.
So, Miraji, I'll just like to ask you about our own organization, the Strategic Institute for Public Health Education and Research. So, what do you think? How can we improve, and what we are doing? Are you satisfied with the whatever we are doing?
Goodness, I think it's amazing what you are doing. You are doing so much for this that that is why, if you would remember, Rakesh, I asked you some time back, where do you get the funding for that? Because how can you keep on doing so much without having any money or spending your own money or something? I think you are doing a lot in this organization, and I really admire you. And the best part is that you are collaborating with everybody. You are collaborating with so many organizations, you are collaborating with all kinds of people. You 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 approach everybody with so much facility, because everybody respects you so much, so they respond to you. I think you both have done wonders. I think you are our leaders in this work. I
So,
mean,
thanks a lot, Miraji, for your words of appreciation, and we just keep being motivated by stalwarts like you and Dr. PC Gupta. And now I'd like to know something about your family and your grandchildren. Yeah.
okay. I have two daughters.
Okay.
The older one is a genius. She is the one who is at Stanford Medical School, and she has got two children. Avantika, who is your student too. She's
Yeah.
very happy that she is able to correspond with you.
Yeah.
Uh, she's at Purdue, and she's doing sports medicine right now.
That is great.
And she has got a younger brother who is in the last year of high school, and he will be going to college from next year. And my younger daughter, who is a model, she's
Okay,
so
that is great.
beautiful. She's a
Okay.
real model.
Okay.
And she has got a one little boy who is 7 years old, a genius. I think Pranay will tell you about him, because Pranay knows a lot about him.
Okay.
And this is all that I have in terms of family. And the most wonderful husband, I must say.
Yeah.
He's
Yeah.
been such a support throughout. He has let me do whatever I want. He's never come in my way, you know. And so it's a great family. And I come from a family where my childhood was very happy childhood. Wonderful brother, wonderful sister, and most gracious parents who let me do what I wanted to do. One of the things I remember, when I was little, I used to climb trees. We had many mango trees in our garden in Bombay. And my mother's friend, she was there, and she would watch me, and she would tell my mother, "Why do you let her climb trees?" My mother said, "Why not?"
So,
They
Yeah.
let
so
me do
now,
anything I wanted,
so
you
now
know.
we know the source of energy. So it is the family.
Right,
So
right,
thank you.
right, right. So, ma'am, last words from you on this International Women Day, because you are an amazing woman. We can see from your career, personal, professional, how you have been motivated and how you are motivating others, the youngsters like all of us. And so, what's your message for young girls and women on this International Women Day?
I think on the International Women's Day, I think what is very important is for each woman to assert herself, but assert herself not in an ugly manner, but to assert herself with all modesty, with all humility. And I think that is what is important for women. In order to be noticed, they have to be humble. In order to be noticed, they have to be gracious. And in order to be noticed, they have to be assertive. I am sure that you have heard this many times, that if you educate a man, you educate just him. But if you educate a woman, you educate the whole family, you educate the whole community, you know. So my message today is that please facilitate your abilities further and educate everyone around you. Be gracious to everyone around you. Be understanding and be humble.
Thank you. Thank you, Miraji, for such supporting words. And I think the young men, not only young women and girls will be benefited out of it, but men will also get energy out of the words which you have got, which you have told to us in this interview. And thank you from Cypher Health News for being part of this special health interview. And despite your busy schedule, you are part of us.
So thank you, Miraji, for being with us from
Thank you.
US, Fremont. It is called Bay Area, and it is quite late in the evening for you. So thanks a lot, and thanks all viewers for watching Cypher Health News. Thanks a lot.
Thank you.